asking questions is really uncomfortable because it's an admission you don't know something. 5-year-olds ask up to 2,500 questions a day. Women's health is imagined as anything to do with stuff that's covered by a bikini.
The stories we tell shape the futures we build.
Every cell in the body has a sex.
Hi, everyone, and welcome to Flip the Focus. We are the factory reset for the tech industry. Today, we're talking with Amy McLennan, who is a medical anthropologist and systems thinker at ANU School of Cybernetics. She researches how tech interacts with human well-being, chronic health, food systems, and policy. She designs solutions that put people at the center of complex systems, layering her own lived experience to keep every aspect of her work grounded in the human experiences of health. And on a personal note, it's pretty rare that we have a guest on who's already made me cry before we have them on the podcast. And that seems like a weird reason to invite someone on. We saw you at South by Southwest last year and just found your work so profoundly smart, but also profoundly moving. And it reflected some of my own personal experiences, but also just conversations that I've had with so many female friends. And I thought it's absolutely the perfect example of what I think positive tech should be about. So I'm really unashamed in saying I'm super excited to have you on today, and thank you for coming.
Thank you. Well, it's also the first time I've ever been on a podcast where I've managed to make someone cry prior to the episode. So we're all in the same boat.
Yeah. So let's try not to cry during the episode unless it's happy tears.
I mean, life goals right there.
Yeah. Over to you, Nico.
On Flip the Focus, every question is in good taste. Thanks to Goody Beans Coffee, this one is now in great taste. Like us, Goody Beans looks at things differently. They do it by creating employment opportunities for people facing barriers to work and reinvesting all of their profits into initiatives that help provide essential human services. The only question now is, when are you going to stock up on your coffee beans? Head over to goodybeans.com.au and claim your exclusive discount with code FLIPITGOOD to get 10% off your subscription plus free delivery. Let's get back into it. Every guest that we have on has an origin story. So let's find out what got you into tech. Could you tell us what tiny moment you think put you on the path on a career in tech?
I finished studies, my undergraduate degree in biomedical science. And at the end of that degree, I thought I might want to go into medical studies. And I thought, well, maybe before I do that, I'll take a year off to see the world and do some work. So I applied for a job as a research scientist, and I turned up and did the interview. And a few days later, I had a call, and the people making the decision said to me, look, we're not going to recruit you for this role because we think you'll get bored. And I was like, well, that's interesting feedback. And they said, but we've got this other thing, and we were wondering if you'd be interested. It doesn't have a name yet. And me being me said, sure, that sounds interesting. Let's give it a go. If you can see something in me that would be useful in this scenario, then I'd be really interested in exploring that. So I ended up being recruited in a role that was half-time with the Department of Health in South Australia and half-time with the Royal College of Surgeons, attempting to figure out how to manage the robot revolution. Now, the robot revolution had happened because the state in 2005 had been thinking about acquiring a surgical robot, a Da Vinci machine. It's a bit of a sidebar. That machine that we're talking about is now in a museum, which makes me feel a little bit old. And they've done some assessments.
Doesn't it? We all feel like the tech's gone so fast. Yeah.
You wanted an origin story? Mine starts in a museum these days. So the Department of Health had done the assessment and decided that it would not be worth investing in this machine at that point in time. And the Royal College of Surgeons had equally been consulted and agreed to that. And a wealthy donor had come along and said, well, Melbourne's got one, and so I'm going to gift one to the state, which meant suddenly the surgeons were unhappy because they thought that the government had gone behind their back somehow. The government was confused because they were like, well, we haven't budgeted for, what do we even do with this? And there was a role that they wanted kind of filled in there somewhere, which was figure out this mess and what we're going to do with this thing. So my real encounter with tech for the first time was just being landed in a hot mess of what on earth is going on. And I think, what I discovered through that role is how tech is not really a standalone thing. It's not about the metal. Tech is an enabler of complex systems, and when you land something like that in existing systems, it disrupts everything around it. I wouldn't necessarily recommend that approach to tech introduction in all contexts, but the ripple effects have been really, really wide around it.
So give us the spoiler alert. What happened with it? What did it become?
A whole series of conversations arose. I think the real advantage to me not being an expert in the field was that I was better able to convene experts. And I suppose I was really in a role where I was asking just a lot of questions and trying to understand what was going on and help build relationships around this thing. The spoiler alert is that one of the biggest barriers to using it was that it didn't fit through the door. And the hospital at the time, the Royal Adelaide Hospital, was in a building which is heritage listed. There's only so much that could be done. And what we found was that the wall cavities were not sufficiently wide to house the cabling, and the doors wouldn't fit the machine through the door. So several decades later, we actually have a new Royal Adelaide Hospital, and one of the catalysts for that particular building being built was that the technology on the horizon just couldn't be accommodated in older infrastructure. So one of the things that really unfolded was a series of conversations that led into places and collaborators and questions that were completely out of scope for the Department of Health. We weren't necessarily talking about, we're going to do surgery with technology, we need a new hospital because walls. There were a lot of conversations that had to be wrangled around, well, who does the maintenance and what does maintenance look like and what kind of skills do we need for that and how much do we need to budget, which hadn't really been thought about when you kind of gifted this piece of metal. There were questions around how it disrupts surgical training. And I think this remains one of the really big questions in this space is, you go from having a scenario in a surgical operating theatre where you've got a patient and you've got a team effectively gathered around that patient working together. And that may include everyone from theatre nurses to surgeons to assistant surgeons to students who are also watching and learning, into a scenario where you have one surgeon who's kind of plucked out of that team and sat by themselves on a console that's hard for anyone else to see. Many others still around the patient, occasionally getting thumped in the face by an arm of a robot that flings past out of nowhere. And I think, we're still wrangling with how do we introduce technology in those kind of spaces. So I suppose the upshot is some problems solved. Certainly now a piece of technology that's used routinely in surgical contexts in Adelaide and around the world. Also challenges still remain.
What type of surgeries is it used for?
Well, originally it was donated specifically by a male donor who had prostate cancer and required surgery to amend it. And it was initially brought into the system to do that particular kind of surgery. And straight away, you can see that there are a number of other questions that arise around access and gender equity. The donor was pretty explicit, though, and a lot of the donors' kind of words are recorded in parliamentary archives and stuff like that. So we can see that they did have a strong emphasis on access, and one of the reasons they donated it was they wanted it to be available in the public system, not in a private hospital.
Oh, that's great.
Yeah, so there was certainly consideration there. And I would say probably in the last 5 years, we've seen a lot more thinking in health and medicine around women's health in particular. And that wasn't a conversation that was happening back then. Now we do see it more routinely used in laparoscopic surgeries for endometriosis and all sorts of other things. But when it was first introduced, I suppose prostate surgery was really, men were the guinea pigs, if you like.
Yeah. Well, so many places we could go with that, but we'll choose not to. And where I'm going to go with that is I was reading yesterday, speaking of how old we feel, I was reading yesterday that the movie Frozen is older than the first female cells, or the first law which required female cells to be used in early stage prescribed medication testing. So
that is wild, isn't it?
Yeah. And the thing that really blew my mind was I read it and I shared it on socials because it's interesting and we don't necessarily know that. But I realized afterwards my response to it was, I didn't really have a response to it. I was like, obviously, I've got
That explains more than it doesn't. Yeah.
I'm just so used to, like it's the Caroline Criado Perez work, right? Like men are the base level data for everything. The thing that really killed me, it was the toothpaste. I didn't know about how the pH level in toothpaste is designed for the pH level in men's mouths, which is different than the pH level in our mouths. And that's why, so toothpaste is not as effective, broadly speaking, for women as it is for men.
Yeah, right. Now that is one I had not heard before. But I mean, but this is the reality, right? Is women's health continues to have what they call the bikini problem, where women's health.
I don't know what that is, but I need to know immediately. That's amazing.
Women's health is imagined as anything to do with stuff that's covered by a bikini.
Wow. And that's it. And the rest of you is the same as a guy, right?
Right. And so, and in practice, what we're finding the more we ask the questions, and of course, asking the questions a first step, is that every single aspect of medicine and every single specialty, there are gender differences. And that's unsurprising because every cell in the body has a sex, chromosomes. And obviously there are kind of some people who sit on boundaries and in between those categories as well. But by and large, if we're talking men and women, every cell has a sex, and therefore everything may well be different. An optometrist can tell you that your eyes are different if you're male versus female, and that you'll have different responses to your environment, and that you will age differently and respond differently to drugs and hormones with vision as well. Does
that explain why we can see when we open the fridge, like we can see where the ketchup is? Is that?
Well, it's worth asking the question, I think.
So that's a real thing, Nico, now. Oh no, we can't tell Nico that because he'll now be using it as an excuse. He'll be like, I am biologically incapable of finding things.
Yeah.
That's amazing.
Every aspect of medicine we look at, they're bound to find gender differences. We're starting to find a lot more in cardiology, for example, and the presentation of heart attacks is different in men and women. So, for example, men and women are shaped differently. Therefore, you've got different forces through your joints. So thinking differently about how the surgery is done and the implications if you remove cartilage or carry out an arthroscopy on future mobility will be different in men and women.
If we talk about, I guess, tech's ability to be inherently positive, what do you think? Is there a particular person or a particular example of technology that stands out to you as kind of the first time that it really struck you? Oh, this technology is, I can really use this for good. This is something that can significantly benefit people.
My grandma lived to just over 100. And towards the end of her life, I sat down with her and did a whole series of life history interviews to understand what she'd seen and lived through and experienced. And it also just gave us different things to talk about when we were having conversations. And when I spoke to her about her childhood, she had to leave school relatively early, so in her very early teens, to stay home and look after the family and especially her ailing mother. And for her, that was an absolute prison, for want of a better term. She loved going to school. She loved learning. She wanted to be out and about and staying at home all day. And she described her days that were long and full of sweeping and washing and tidying and cooking. And then she has this moment in the story where she says, and then we got a vacuum cleaner. And it changed her world.
Right.
This piece of technology, she found one early. She convinced the family to get in and be early movers on it. She helped save the money for it. And then when she started using it, the amount of time it gave her back, but also just the amount of joy in doing things that were mundane tasks that were suddenly interesting and different and something she could think about and engage with differently. How is it working? And if it broke, how do you fix it and tinker with it? I think for me was it was a moment and a story that's really stayed with me around the role of tech and the way that it can just bring joy.
That's extraordinary. I do love that. And again, we talked about this earlier, that use of the word technology. It should be broader than this really narrow definition that people have of it now, or, you know, that our minds have been programmed to think about. Technology is supposed to be anything that, you know, it basically does a thing a human can't do, or does it a bit better than a human. And I love those stories. They're not from that long ago. This is like 1 generation ago or 2 generations ago, and it profoundly changed her life. It meant, you know, she's not spending 4 hours doing something, she's spending 20 minutes doing something. That is a profound shift. And I love how you related it back to, you know, then the possibilities that are available to her, because what's she doing with that time instead? And she sounds, I mean, I guess maybe it's in the family then, like a naturally curious person. She's like, okay, how does this work? How do I fix this? How can I use this knowledge for different and more exciting things?
Yeah, absolutely. And I think it's contextual as well, right? Like, especially in some of these early technologies, and, you know, even today, there isn't necessarily someone who can come and maintain it. That skill set doesn't necessarily exist yet. You can't just take it to the shop or send it back, or, you know, the robotic surgery was the same, right? We were like, well, who fixes this? Now in that case, she was able to tinker with it herself. And I think one of the things that is different about maybe tech that's enabled by, say, AI, is that it's not necessarily something that one can tinker with as easily. And it may not even be something that a single person can maintain, because you've suddenly got lots of different parts and lots of different skill sets required for upkeep and maintenance and quality checking, everything from hardware and software to the intricate parts of software to quality assurance. So, you know, I think while tech has a long history and there's a lot more to tech than these kind of AI enabled systems, there is something that, as AI enables more complexity requires really different way of thinking about that too.
Yeah, I think you're right. And what I find fascinating in that conversation as well is perhaps that's what contributes to the fear of AI. Because if you have, you know, a vacuum cleaner or a, you know, combustion engine, or you can open it, you can fix it. There's so much going on with AI. It's like, maybe it's getting away from humans now. If we can't like see its inner workings, we don't know what's going on. How do we change it? How do we fix it? The vast majority of people, if you say AI, they hear ChatGPT or whichever particular LLM you use, right?
Or the Terminator.
And so, right. And
Yeah.
so, yeah. So for them, the conversation becomes, oh, it's all going in this really negative direction. And, you know, big tech are controlling it. And when you say something like, that could be true, but have you thought about if you just put good stuff into it and positive stuff into it, and, you know, you can actually affect the change that you want to see as well. And I think we were talking earlier about how slow we are as a species, as humans, catching up on things. I think that's what this job is. You know, it was quite apparent if you got a vacuum cleaner, something made a funny noise, you turn it over and you look under it. Oh, okay, I can probably do something about that.
We know that fear is really closely linked to uncertainty. And I think that's why education is really critical in this space. And certainly the kinds of education work I focus on are less on how do I teach people how to take apart a single thing or a single piece of technology. And instead, what is a set of, say, questions and a language that I could equip you with that allow you to go into any encounter with an AI-enabled system or emerging technology and start to make sense of it and take it apart. And so, and with these kind of systems, it's just as much about taking them apart kind of intellectually or thinking about it, because you've got data and software and concepts and assumptions that are built into it, as well as taking apart the technology and the logic of the kind of the hardware, the logic of how it's all connected.
Tell us a little bit more about that mindset, because I imagine as somebody, it seems that you've always had that mindset, like you're interested, you want to learn things, you were thrown into this terribly complicated, misunderstood thing in your first job and were like, okay, well, I'll figure it out. So now you're teaching other people that mindset. So talk to us a bit about, you know, is there a process you follow? Are there structures? How do you help people understand that being curious about tech and asking the right questions is a teachable skill?
One of my starting points is asking questions is really uncomfortable because it's an admission you don't know something. For some of us, it could feel like maybe I'm imposing on whoever I'm asking. And maybe it's fear that we get the question wrong. And here's, fear coming up again. And I think for me, certainly early in that role, something I learned a little bit accidentally, I was straight out of high school. So I basically had learner plates strapped to my back. It was very clear to all of the senior people in the policy world and the surgeons and senior clinicians that I was not an expert and that I was very much still learning what on earth was going on here. And I think that kind of framing of me as non-expert helped me be comfortable as well, just asking questions. I wasn't embarrassed to ask questions. Frankly, I didn't know anything that was going on and I was just thrown into it. And I think probably some of that attitude I had learned the year prior. I went and did a year's exchange in France, and I had learned some French in high school, but I had not really mastered the language. In fact, one of the reasons I thought it might be fun to go to France would be to improve on something I really wasn't very good at, which seemed like a great idea at the time. And then, I arrive and land in the country and there's this French language going on all around me. And I'm standing there thinking, I have made a terrible mistake.
You're like, I did not think this through.
I did not think this through. But what I did learn across the arc of that year was I didn't know what I was saying. And the only way to learn it was to ask questions and copy people and be humble and make mistakes. So I think, and I learned through that whole year, it's not going to kill me to do that. And so I really carried that attitude, I think, into this job then. And I think I've really carried it through since. So, on the one hand, I appreciate I'm never the expert in the room, because there are always people who know the piece of tech better, or who know the policy better, or who know the context better, or who know the patients better. But I can ask questions, which helps them be the experts. It helps me understand the context and connect dots more and to kind of summarize things. And, I've discovered that if you ask people questions, generally they're really generous with their replies. I have a 5-year-old, and 5-year-olds ask up to 2,500 questions a day.
Very tiring, aren't they?
They are very tiring, but they're also incredibly good questions for the most. There's the random ones, but even then, they usually lead to an interesting conversation. And I think that kind of spirit of curiosity and just asking is one that somehow we lose as adults. And I think something that's really magical that I'm continually reminded every day when I'm asked these questions to come back to and keep practicing myself as well. Well, and that's where I think education can also play a role too, right? In thinking about, well, what baseline understanding or words or terms do I need to best equip people with to be able to see themselves in a conversation, or how do I help people understand, which expert would you even ask this question of, and how do you understand which experts need to be in the room? So I think there's more we can do there. I think if we just say to people, go out and ask questions, it's not necessarily giving people enough equipment to go out and do that effectively. And anthropology, one of the big skills you learn in an anthropology degree is, again, a kind of a next level again of question framing, and also then listening to answers, and not just listening to the words, but listening to the body language and the context and what's going on behind someone or around someone, or what shoes they're wearing. So there's kind of how you listen to an answer is also a skill that you can develop, and to help you engage and learn more about these kind of technology.
You'll see Nico and I doing a lot of nodding and smiling, because that's the literal conversation we had. Because so much of what you're saying is the same as a podcast, is the same as running a podcast. Yeah. Listen, I've asked you about the tech itself. I want to talk to you a bit more about individual people. Like, when you think back to, it can be the earlier days of your work or something more present day, but is there kind of an individual person who you think about how much you've improved their life or their quality of life through the work that you've done, through the tech that you're using and developing?
This is going to flip your question, but in the spirit of flip the script.
Please.
It's really got me thinking about people that have stayed with me, that have achieved kind of good outcomes at scale. So I think I took your question and thought about it. And, in my context, I can think about maybe individuals. I do a lot of work with, say, individual patient experience, and then making sense of the broader picture as well. And I certainly have notes from doctors who will say, or professionals who will say, thanks for this piece. It's helped me make sense of what I'm doing, or it's given me a new way in. But I think the work that I do at the moment has a long tail. So I suspect I could answer that question better for me in 10 or 20 years' time. If I think about something that happened 30 or 40 years ago that's really stayed with me as people who have used technology to affect change at scale, I think of emergency medicine. Imagine a time within the last 60 years, imagine a time before ambulances existed and before CPR existed. If you had problems, if you had a heart attack or if you'd had an accident outside of your home, the most common approach was to say, well, the best care you could get is in hospital, and we just need to get you to hospital as quick as possible. So people would normally get thrown into the back of a police car and sped to the nearest hospital if you were lucky. And if not, there would really be no help at all, because it was believed that healthcare happens, the kind of emergency healthcare that you'd require happens in a hospital. And it took a large team of people, and I'd say it's not one individual, it's a large team of people coming together around multiple kinds of technology, from CPR, which is, kind of an intervention as technology, ambulances, what they look like, what you'd need in a car, and the kind of concepts. So even rethinking this assumption that best treatment happens in a hospital to best treatment happens on the roadside. And they came together and they experimented and they developed an ambulance service and started to unfold that model locally and around the world. And what's really remarkable to me is that a large proportion of that team was the Freedom House Ambulance Service. There's actually such a really good podcast about it and an amazing book about it called American Sirens. And I will send you a link so you can link people to it. What's really incredible about it is it's a group of African-American people from a really impoverished neighborhood in the US. And we haven't told their story until the last kind of 5 or 10 years. And so for me, some of the people having the biggest impact in this space are people whose stories we've never told or heard, and often people who are working in teams rather than as individuals. So I think that is one that's really stayed with me, as they have changed for people's outcomes around the world. Every day people are saved because of emergency medicine and because of ambulances. And we barely know their story.
That's very cool. And it's also completely true. It's just, the minute you said it, it's just one of those things that you assume has been around, like maybe they used to have like a horse-drawn version of that. You don't think, people, because it's the concept of healthcare is best administered in a hospital, the end. Yeah. Not like, how are you going to get there really fast and maybe you could have some on the way. Yeah.
In the case of eggs, what is wild, you get me on a tangent now about eggs, but I promise I will not. You can edit it all out.
We love your tangents. Go.
I mean, what's really wild is you say it's all around us, but even until I started looking at eggs and the COVID pandemic, I don't think I realized just how much. So if you buy an egg at the supermarket and you scan it at the checkout, whether you do or someone else does these days, the moment you do that, that data point feeds into a whole range of systems which manage everything from stock levels to the HR management on the floor to the supply chain to the planes and trains that are connected into that supply chain back to the growers. I mean, short of putting plugs in chickens when they don't need more eggs, there are certain things we can't control in the ecosystem, and animals and bodies and some of them. We're controlling things like it's connected to things like ordering systems, to advertising, what's being advertised and when, and banking and finance structures as well. Every time you buy an egg, and it is wild to me that kind of level of feedback exists in real time. We don't even think about it.
Do you know? See, not only do I love your tangent, I'm going to join you on it and build on it. Are you aware of the amazing campaign that Y&R did? Because the definition of like a free range egg is a bit too broad in Australia. They were trying to like level that up and add some interesting proof points. And so they attached tech, which is basically a pedometer, to the chickens. And then they now print on the egg how many footsteps, how many steps your chicken walked, your hen walked.
And have we studied things like whether that leads to different properties of the egg itself, as in higher protein levels or cholesterol?
Now that I don't know, but I love your thinking. I'll feed that back to the agency and ask them. That could be round 2 of their campaign, Amy.
Yeah, absolutely.
Just won them a bunch more awards and you don't even know it.
Well, this is the question, right? Is, we can do all of these things and it's great. And then you kind of think about, well, what are the ripple effects of that? Is it improving human health or not? Is it making worse eggs? Who knows? What are the environmental impacts of chickens that walk further, greening the economy somehow? Or actually is the cost of producing the pedometer and managing that data outweighing any benefits from being free range? Because of course there's a whole range of infrastructure involved in kind of managing that data, from cooling data centers with water right through to kind of the infrastructure of computers and the pedometers themselves. So, is there net benefit? In which context is there net benefit? And if there are losses still, how could we improve or optimize those? Can you apply it to other fields? So many questions.
You need to get into farming, because the only answers I know that I can help you with to that is it was existing GPS tech they were using anyway. And I think it might have come from cows originally. Like farmers were looking at like milk production levels and seeing how much it had to do with how far their cows walked and which particular bits of the field they were in, and therefore which bits of grass they were eating. And they were trying to track all of that. And then so it became apparent that you could measure the chooks in the same way. And so, thus a thing they were doing anyway became this very cool. And then there was the whole tech. This is the bit Nico will like. Then there was the whole tech of, well, how do we print on the egg without breaking the egg?
Yeah, interesting.
Yeah.
And of course, tinkering with these kind of things goes back well before AI technology too. In the UK, we consider, for cultural reasons, brown eggs to be healthier. So we've bred our chickens and used technology to create more brown eggs in the economy and done away with the white ones. In the US, it's the opposite. Actually, white ones are generally considered healthier. And so there's a different kind of program there over time. And with other livestock, similarly pigs and cows, over time we've believed pigs fed one thing are healthier. Then over time, pigs penned up small are actually better meat. And then pigs that have free range are better meat. So these kind of conversations play out over history. And it's just, this is a new kind of tool to do the same thing that we've been doing for a long time in a way.
But that was kind of the approach to education at the early AI days as well. As kind of the only people in the tent in the early AI conversations were the kind of behavioralists who believed that learning was just like input in, output out. And one of the reasons that those particular learning people were in the early AI conversations was because their views aligned nicely with the early computing people. And it's like, well, to one of your questions, if all you do is work with people that you agree with, then you end up just reinforcing your own biases and building a very one-dimensional world.
And I mean, so many questions that come off that, right? If you think about, that particular conversation around the industrial education complex, it's very Sir Ken Robinson, right? And, his theory of we just created the school system. Well, I mean, it's facts. The school system was just created to replicate the industrial system. So you put a certain... You put any person into it, you force them into the shape you want them to be, and they'll come out how you want them to be. And, the realization that isn't the case, because we're humans and we're not like a manufacturing material. But I think fascinatingly with AI, it's that simple switch. I think often if we could get people to change the language from AI to in most cases, most people who don't work deeply with AI are using large language models. And if they remember, it is machines, it's machine learning. So it's, exactly to your point, you get out what you put in. It's not like the machine is not having its own thought process around this. Like is it gathering loads of other information? Yes. Is it autonomously thinking? No.
It's all just pattern recognition. Yes.
Yeah. Yeah. And I think if we went back to referring to it as machine learning, anyway, I would think that everything is a branding or narrative problem for me. So that's how much
I think one of the interesting things is everyone thinks AI is basically it's like a year and a half ago it started. Like that's genuinely if you talk to people, they're like, oh yeah, a year and a half ago it all changed. And I'm like, the whole idea of AI has been around for so much longer.
Yeah, absolutely. Yeah, I mean, you could choose to start that history anywhere, right? Like Greek mythology or earlier Asian mythology, or, the 1950s post-war, and then, hatch the name. Like, so many ways to tell that story.
It's so interesting. And it does go through we were talking to, it was Kate, wasn't it? Kate Tolnar for IBM.
Yeah.
We were talking to about the first, like recorded use of AI, which was, I want to say it was in the 60s. I feel like it was in the 1960s. Yeah. And so, to your point, Amy, we can trace the way of looking at the world and organizing information, way back further than that. But the actual technologies existed, for more than most of our lives. But it's just, I don't think the vast majority of people want to accept as humans how slow we are on the uptake. And that's just a reality of the world, right?
Yeah, I think everyone remembered what's in the IBM computer, that first one, the first chess thing, and it feels so like, wow, look at that, that's incredible. Like we made a machine that could beat a human, and like to a certain extent, if you actually think about it, it's just from a computing point of view, it's most probably not that difficult because there are only so many moves that it can make. So.
Well, I mean, machines are humans all the time. You look at how did we build the pyramids? Well, we couldn't carry bricks by ourselves, so machinery carried the bricks, like beat humans in strength. Like this is why we use technologies to, augment or achieve tasks we can't do by ourselves.
Right, but what you're doing there is exactly what I do, which is using the terms machinery and technology in their real actual defined terms, which is not what we normally do, right? Like technology, machine, you're literally, if you're rolling a stone on like a little contraption, that's a machine, that's tech. Like that's, and it's a conversation we have a lot when we say to people, the podcast is about technology, and people are very confused. For example, when I said, we're having a couple of social media influencers on, they were like, what's that to do with tech? I said, what the hell do you think social media is? Like, it's not someone standing on their roof like shouting at next door. That is what technology is.
Because we had such a good chat with Dr. Amy, we actually ran quite long. So what we've decided is to cut it into 2 episodes, isn't it?
Yeah, there's always an opportunity to edit it right back. But with this particular conversation, it was so interesting. And there were so many really different segments of it that we felt were all relevant, and you would love to hear all of them. So we didn't want to deprive you of any of them.
Yeah. Thanks for spending time with us today. Please subscribe, rate, and review Flip the Focus. It helps us bring you amazing founders, funders, and leaders asking big tech questions. See you next time.